Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. When you and your spouse both qualify for health insurance through your employer, there are a lot of factors that go into deciding which one to choose. But it doesn't necessarily have to be one plan or the other. Here to tell us more is Shawn Stack, a policy director with the Healthcare Financial Management Association. Shawn, when does it make sense to choose to take both insurance plans rather than just one?
So, if both spouses work and both employers offer health insurance, it can be beneficial for each to be primary on their own employer's plan. So, the wife would be primary on her plan, and the husband would be primary on his plan, and then they would have each other's plans as secondary. That type of setup could lower out of pocket costs by coordinating benefits and covering the deductible, the co-insurance, the co-pays from each of their primary plans. It could also provide, depending on the nuances of any type of chronic care needs they have or medical needs they have, it could also provide a broader network of provider access.
I want to ask you a quick follow-up question on the deductibles, because if I take my insurance, my husband takes his insurance, we're using each other's for the secondary, does that mean that I can cover my deductible with his plan?
That depends. That depends on the plans in question, the two employer-sponsored plans that are in question. If the secondary plan only pays if the primary doesn't fully cover something, and that's in the secondary plan, then no. I would just say, ask both insurers how their coordination of benefits works in your very specific case, or your HR person if they know insurance really well, and then run the numbers. Compare the dual premiums versus the expected savings for dual coverage. If one plan is clearly better, you might consider opting for only the better plan rather than having both, if you can do that, if the employers will allow you to do that. And then does one of your employers offer a FSA, a flexible spending account, or an HSA, a healthcare savings account, and what strategically works better for your household based on your conditions? So lots to think about there.
Yeah. And there are definitely, as we said before, several factors that go into the decision, not just to go with both spouses coverage, but which one to choose. So that'll do it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.